Hello, my name is Anita, and today I'll be discussing the relationship between sleep and alcohol. Before I begin, it is important to understand what an optimal night of sleep is, then to understand how alcohol can affect it. What is an optimal night of sleep? During sleep, our bodies experience two different cycles, non-REM and REM sleep. We go through phases of being in deep and light sleep where we can react to any sounds or movements around us. This picture here shows the 4 stages of sleep our bodies go through and what occurs in each one. The first 3 stages are considered to be a part of the non-REM cycle, non-rapid eye movement. The 3 stages consist of wakefulness, light sleep, and deep sleep. These 3 stages combined allot for about 75 to 80% of the time we spend asleep. The other 20 to 25% we are in REM, rapid eye movement. This period of sleep is marked by extensive changes. These changes include accelerated respiration, increased brain activity, eye movement, muscle relaxation, and most commonly known for the period where an individual can dream. Moving forward, it is also important to understand alcohol and what it does to our bodies. Here at Boise State University, according to the NCHA, 77% of students who attend have reported to using alcohol. Out of those students, 78% of them have reported to having at least one drink within a 3-month period, and then 14 reported to binge drinking and blacked out. According to the CDC, binge drinking refers to consuming 4 to 5 standard drinks within a 2-hour period. For men, it is 5 standard drinks, and for women, it is 4. Drinking affects each individual differently and different for every age, gender, body type, and physical shape. Here's a photo of what is considered to be a standard-sized drink for each type of alcohol percentage. Along with drinking, the amount consumed is measured by your blood alcohol concentration. It is the percentage of alcohol in your bloodstream. For example, a BAC of 0.10% means that an individual's blood supply contains 1 part alcohol for every 1,000 parts blood. Factors like the number of standard drinks consumed, the number of time, the body weight, water composition, sex, any medications they may be taking, and the amount of food they consume can impact what their BAC is. This chart here shows each BAC level and the physical and mental effects it will cause. Your BAC can also affect sleep and what it does to your body's ability to rest. Many times individuals experience sleepiness while drinking or have heard the saying that a drink or two can help you fall asleep. Overconsumption or long-term use can cause reverse effects and make sleeping more difficult. Some effects include delayed sleep onset, poor quality of sleep, and a shorter time span of being asleep. Researchers have noted a link between long-term alcohol abuse and chronic sleep problems. People can develop a tolerance for alcohol rather quickly, leading them to drink more before bed in order to initiate sleep. Delayed sleep onset is when the body has a difficult time initiating the beginning of sleep. This can result from the BAC levels typically peaking 30 to 60 minutes before bed and disrupting the body. 28% of students at Boise State currently experience difficulty falling asleep, and it can be increased with the use of alcohol. Along with delayed sleep onset, it can cause poor sleep because the body may have a difficult time going through the non-REM and REM cycles. It also reduces the time span of being asleep. 42% of students do not receive the recommended amount of sleep, and alcohol may play a factor into why they do not. This chart shows the drinking behavior and how acute and chronic use can affect the REM cycle and the time spent asleep. A high dose reduces the time that they are asleep and also decreases their REM cycle, which normally helps the body stimulate brain activity, which in return can increase memory retention and is essential for learning. Studies have also shown that heavily or consistently drinking can affect sleep long-term. One long-term effect is sleep apnea. Sleep apnea is when the body can no longer regulate breathing while asleep and cause abnormalities or long pauses between breaths. It increases the risk of mortality from strokes and heart disease. Another long-term consequence is chronic insomnia. Difficulty initiating or maintaining sleep for longer than 3 weeks. 10% of all alcohol-related problems relate to insomnia. Other consequences include impaired daytime alertness, making it more difficult to pay attention during the day, memory dysfunction, having a harder time remembering things. It also increases the risk for depression, which 25% of students have already reported being depressed. Why is it important? It is important to understand alcohol and how it can affect different parts of the body and what can happen long term. Drinking safely is important and can help reduce long-term consequences like sleeping issues. For college students, difficulty sleeping is linked to other aspects like academics, so it's important to get a good night of sleep. There are many benefits to getting a good night of sleep. It results in better moods, increased academic performance, boosts your immune system, increases productivity, improves memory, reduces stress, and lowers the risk for serious health problems. There are also resources to help improve sleep. The first one is the Boise State Health Services. It is located on the second floor of the Norco building. This is a resource if you'd like to be able to speak with the professional. There are also other resources like sleep tracking apps and devices that can help track your sleep and see if improvements need to be made. Thank you for your time, and I hope this information was helpful.